Today we're going to talk about Chapter 4, the female genital system. This is a slide that is kind of busy, but as most of you probably know, the female plumbing is quite complex. God in His wisdom has made so many parts of our body to allow us to reproduce, and it is very complicated. The textbook chooses not to focus on any of the maternity codes or the delivery codes, so I will just barely touch on those in my lecture. But just suffice it to say that the best way, I think, to code is to get very accustomed to navigating the code book the way I've shown you from the table of contents. I'll go over that again today just to be sure you understand. The index is helpful most of the time, but once you really know your code book, there's a very good chance you can just code directly from the code book, bypass the index, and go straight to that section within the code book that would answer your question. One thing I want to make a point of emphasizing is the difference between a hysteroscopy and a hysterectomy. Obviously, the hysteroscopy is the scope that allows the physician to look inside the uterus, and it is not uncommon for a D&C to be performed through the hysteroscopy. We'll talk about that a little bit later too. There are 3 different kinds of hysterectomies that have codes assigned to them. One is the supracervical, meaning above the cervix, vaginal, where everything comes out through the vagina, and then the total hysterectomy, where the uterus and the cervix are both removed through the scope. I can't tell you why the weight of the uterus is significant. I looked around for some things on that, and I couldn't find anything that really answered my question. So just be aware that the weight of the uterus does come into play here. And then there's the traditional excisional approach, where the incision is made through the front wall of the abdomen. As I mentioned earlier, I'm just going to briefly touch on these maternity care and delivery codes for physician services. Recognize that some CPT codes address global care, and some report only a portion of the maternity care or delivery care. For example, there's 2 given here, where CPT code 59425 would be for antepartum care, 4 to 6 visits, and 59510 would be for a physician who was doing the care for the patient from the cesarean delivery from start to finish. Again, going back to reading those descriptions very carefully. Now let's talk a bit about the global service package, the way that is reimbursed by the insurance company. I have here by bullet points those parts of a global service package for the antepartum, which is the care going up to the delivery. Then here's your delivery codes. Here's these services under the global service package for delivery services and for postpartum. Even though the code book has these codes available, the textbook barely mentioned them and does not have any exercises pertaining to them, so I won't spend a lot of time on those. Let's look through some of our exercises. 435, number 2, the laparoscopic fulguration of fallopian tubes. Here's your code and the pathway in the index. You notice that another word for fallopian tubes are the oviducts. And here's a D&C performed for a patient with a diagnosis of an incomplete abortion. And the anatomy fact to remember is the part of the female genital system that is applicable here is the corpus uteri, when you're looking at the different subsections within the female genital system. The corpus uteri is the main body of the uterus above the constriction that's behind the cervix and below the opening of the fallopian tubes. So if you were going to do a D&C, you would be doing that on the corpus uteri. And for a review of what a D&C is, the D&C is the dilation, where the cervix is dilated and a special instrument is inserted to scrape the uterine lining. That is done during or after a miscarriage or an abortion, or to remove small pieces of placenta after childbirth. They commonly will do a D&C when a patient just keeps bleeding and they're trying to figure out why, and they'll go in and do the D&C, and oftentimes that takes care of it. The D&C can also be used to diagnose or treat growths such as fibroids, polyps, uterine cancer, different things like that. So back to our question. In the index, dilation and curettage would be the main term, and corpus uteri would be the part of the body that is having the procedure performed on it. Abdominal hysterectomy with a salpingo-oophorectomy. The procedure fact to remember here is that the removal of both the ovary and the fallopian tube is called a salpingo-oophorectomy. If it's unilateral, it's referred to as USO, unilateral salpingo-oophorectomy. And when both ovaries and both fallopian tubes are removed, that is called a bilateral salpingo-oophorectomy, or BSO. And there would be the code. Obviously, you didn't need to know all of that to be able to find that code, but I think it is important because it's possible that you would have a procedure that would not be a hysterectomy, but would be strictly the salpingo-oophorectomy. And the operative report that's given, number 2, diagnostic hysteroscopy with a fractional dilation and curettage. When you read this code description, you notice it states with or without the D&C. So you would not code the D&C in addition to the hysteroscopy. And there's your codes. You're coding the with biopsy because it says diagnostic hysteroscopy, implying the biopsy. Exercise 437, number 2, the vulvectomy, partial removal of skin and superficial subcute tissue. As a reminder, there are definitions in front of this section of the code book. So let's look at that so we can be sure we're all on the same page. So in here you can see under this part of the subsection, vulva, perineum, and introitus, here's the definitions for when you have an excision or destruction or excision. Exactly what you're doing, how much is involved, is defined here in these definitions. As I was mentioning earlier about reminding you of the sections of the code book and the procedures under it, in red, these are the subsections of the female genital system, and then in blue, the different procedures that would fall under each of those subsections. So it is possible to find codes using your code book and never go to your index. So I encourage you to try that sometimes. I think if you get very familiar with the CPT code book, you'll be able to do that without too much trouble. And here are the answers. In here you see the patient desires sterilization and the surgeon performs a banding. And in this example taken from the textbook, the surgical approach is not given, and the selection of a code would depend upon that approach. So if we assume a vaginal approach, we would assign 58615. But in the real world, you would have an operative report that you would be coding from, and there would be no question as to the approach. Here's a biopsy of 2 lesions from 2 different parts of the female genital system, one of which requires a suture closure. And if you read the code descriptions for these 2 codes, you see the biopsy of the vagina includes a suture closure. So you would not be coding the repair in addition to the biopsy. It is included in that code. And a hysteroscopy with removal of fibroids. A fact to remember, another word for fibroid, leiomyomata. And there's your answer. An endometrial cryoablation with ultrasound guidance. And there is the answer. If you have any questions about the female genital system, please post your question on the discussion board along with the index path you use to try and find a code, and I will attempt to help you. Thanks so much and have a good day.